Okay, so welcome to video number 2 of using Homeosetu WebApp. So let's go through an interesting repertory in the Homeosetu WebApp, which is Homeosetu Clinical Repertory, and through a case of Oral Thrush. Now, as I've shared, I am practicing since 17 years, myself, Dr. Alpesh Oza, the everyday homeopath who wants to support the everyday homeopath out there, whoever it is. And we have released the first version 1.0.0 on 19th March. And this is a small demonstration of the Homeosetu clinical repertory in the Homeosetu web app. We are a bridge between academic and uh, clinical subjects, clinical practice, and you need to decide on certain remedy or diagnosis or investigations. It's coming in the app, keeping in mind what every homeopath needs to decide. In every case, we have designed this app. And there are 5 repertories, which is Kent repertory with patient versions, Homeosetu clinical repertory, Homeosetu bowel nosal repertory, Allen's fever repertory, Homeosetu repertory to keynotes and characteristics by Dr. Allen. Let's solve a case using Homeosetu clinical repertory on the Homeosetu web app. But before I proceed, I would like to give you a brief intro of what the case was about. 6-month-old baby, borax failed, sulfur palliated, will happen with many of us in our clinics. And the mouth condition, the oral thrush of this baby was worsening day by day. And the relatives, of course, anyone who would have a small child will get anxious all the time. How do you solve this such a situation? Let's go and see in the Homeosetu web app if it has some answers. Okay, so we will open the Homeosetu clinical repertory. By the way, if you have a few rubrics already recorded from any session previously in our web app, you can clear within a click over here and exit this so that it removes the previous rubrics. Let's go to Homeosetu clinical repertory. Now, this is a repertory which is going to revolutionize your practice because it has various authors sharing something. Hempel, Pulte, Allen, Herring, Boericke, Clarke. I don't know if I pronounced it right, but I am practicing it right and perfectly as the authors lay down in their books. For example, Pulte mentions for children thrush 5 remedies. Now it's interesting to know when you click on certain remedy, you will see that there's something mentioned by the author. And this is what we intend to do. You just don't need to read the repertory rubric or the remedy present in the rubric, but you need to know how the author practiced. And that is what we are bringing. Kali chloricum, a few doses of kali chlor will sometimes cure the severest mouth of infants. What is there for nux vomica? If the constipation should accrue during the convalescence, give opium and nux vomica in alternate doses of 3 globules each, 3 times a day, followed by a dose of sulfur the next evening. This is how they practiced. And the same is mentioned for sulfur and opium because the 3 remedies are mentioned together. Now, in cases where there are some special notes mentioned by the author, we have mentioned in such a case, mothers must not be too anxious to see the thrush leave the tongue and gums at once. This would be impossible. as the healing of the injured surface requires time. Frequent washing will with cold water will accelerate the process. But what seems to be interesting for me after borax and sulfur failed is calichloricum. And with few doses of calichloricum, this patient of mine, the 6-month-old baby infant, improved. This is how our authors, our stalwarts practiced in the early 1800s, early 1900s, and 1950s, or all the last 200 years. And this is how we need to also start practicing. So, similarly, this is what I call Homeosetu lens, an integrated materia medica or prescribing pointer everywhere. You can click any materia medica remedy, any remedy to see the description below it in the clinical repertory or the repertory to keynotes, or you can just search it and then manually locate it. Let me take you to another case of hoarseness and backache which intrigued me, and two different cases. Okay, but how I solved using the clinical repertory. So let's go to the clinical repertory again, and a case of hoarseness. Now you will see that there is Dr. Hempel, Charles Hempel, and this is a case of hoarseness which was not improving with any medicine. Now I was thinking what to do, and there are a series of remedies mentioned by Dr. Hempel. Aconite, is it aconite? Let us read and find out. I clicked on aconite and I found that there is a affection which is the result of cold. It is either a simple congestion of the mucous membrane of the larynx. And if aconite is indicated, merc is also to be uh, the when the aconite is indicated, the hoarseness is much more obstinate than when merc is to be used. The former is generally accompanied by slight fever. Belladonna, hoarseness from catching cold after measles. Carbovage, hoarseness increased by loud talking, or is worse in damp and cool weather and in the morning after rising. So my patient had more issue when he rose in the morning. The voice was not proper. For Drosera, something else is mentioned: Dulcamara, Merxol, and sulfur. So whatever is your appropriate choice of remedy. For me, the carboveg worked in my case. You can decide for you. And similarly, many other conditions by Dr. Charles Hempel are going to land up in your Homeosetu WebApp if you are using this in your clinical practice. A case of backache which I was sharing. And if you want to scroll down to the rubrics, you can scroll. If you want to just come up directly, you can use the arrow button. Now, there was this backache which was troubling the patient a lot. I just typed back and ache, and you can see, you can display it over here. The patient have also had irregular periods, and that's where when we choose the different remedies, we see Aeschylus backache with piles, Arnica backache from overexertion, Belisper again overexertion, Semisifuga with uterine affections. Now this is something I need to give. Kalika with weakness in the back and pregnant woman. And if there is a note, we can also see that it's lumbago and menstruation painful that we need to look at. Oxalic acid is one of the another interesting remedies often overlooked by homeopaths in the homeopathic practice for backache, because we always focus on arnica or rust dogs and macrotin or whatever. So oxalic acid can help, but with oxalates in the urine, this is what Clarke says. And There are other remedies mentioned which you can go through. So similarly, whoever wants to solve interesting cases using Clarke, using Boericke, you can find something interesting in each of the uh, remedies, in each of the rubrics by the author, and it's going to be interesting for you all. So start using the Homeosetu web app so as to revolutionize your practice. There is a Homeosetu Intelligence Clinic Assistant which will help you in a lot of things that you see on the screen. And this is just the beginning. We are coming with interesting new features where you can add your own notes in each rubric and search through your added notes. And we are updating the app on a weekly basis. Patient level sync is not available. We are developing a mobile app, and that's where we will integrate everything together. Until then, you can take screenshots of your repertorization. And if you want to start using this web app, there is a 9-day trial waiting for you all. Log on to our website. The description shares all the details. The launch price is $4.99 per month, and international pricing is $25 per month. So go on and experience a revolution with us.